Good afternoon, everyone. Now we start with the 5 transporting points sa introduction. The 5 transporting points, shoe points, are the points that lie between the fingers and elbows or between the toes and knees. They are assigned to the 5 elements so that they are mostly known in the West as element points or sometimes command points. In France, they are known as the antic points. The Chinese name for these points is shu, which is nearly the same character for the back transport points, meaning the transporting. In order to illustrate the nature of these points, the ancient Chinese compared the section of channel between the fingers and toes and elbows, knees to a river. Starting from a well point at the tip of the fingers or toes, getting gradually larger and deeper and ending in the C point at the elbows or knees. So nag-start po sa toes, which is the well point, and nag-end po sa my knees, which is the C point. Thus from fingers, toes to elbows, knees, there is a progression in the size and depth of the channel. So continuous po yung increase in size and depth. It is narrowest and most superficial at the fingers. So mas narrow, mas superficial sa fingers and toes, and widest and deepest naman sa elbows and knees. It is important to note that this progression of size and depth of the channel is irrespective of the direction of flow of the channels. It applies equally to yin or yang channel of both arms and legs. Even though the yin channel of the hand flow downward towards the fingers and the yang channel of the hand flows upward towards the chest, the comparison of the channel to a river with its spring head at the fingers and its delta at the elbow applies equally to both. Exactly the same applies to the leg channels. So here is the illustration ng nag-start sa well, sunod sa spring and the stream, river, and the sea points. So this is the flow of chi in the 5 transporting points. Here, another illustration from the well points, which is nasa my nail. This is an outward centrifugal movement of chi. This is followed by the spring points, which sweep the chi. And next is the stream, which chi pours through defensive chi, gathers. And next is the river, which flow of chi is wider, deeper, and the pathogenic factors diverted to joints. Sa C points naman, which is on the elbow and knees, chi is vast, slow, movement is inward, and centripetal. The implication of this is that the section of channel between fingers and toes and elbows, knees is more superficial than the rest. And this is one of the reasons for the importance of the points lying along its path. The energetic action of the points situated along this section of a channel is more dynamic than other points, and this explains their frequent use in clinical practice. Indeed, one could conceivably practice acupuncture using only these points, as one may have experienced many times. The effect of, say, liver tree Tai Chong is far more dynamic than, say, liver 10, liver 11, situated on the thigh. The other implication of the fact that the section of channel between fingers and toes and elbows, knees is more superficial is that this section represents the connection between the body and the environment. It is the section of channel which is influenced most promptly and directly by climate and exterior pathogenic factors. So, mas exposed po yung dulo ng sa fingers and toes. For this reason, the points along this section of channels are more directly related to the seasons and can be used according to their cycle. For the same reason, the points along this section of the channel are the points of entry of exterior pathogenic factors such as cold, dampness, and wind. So dito po dumadaan yung mga pathogenic factor, ang cold, dampness, and wind. Another reason for the dynamism of the points in this section of the channel is that at the fingertips and toes, the energy changes polarity from yin to yang or vice versa. Due to this change of polarity, the chi of the channel is more suitable and therefore more easily influenced. Even though we normally say that this change of polarity takes place at the fingers and toes, it cannot take place immediately at one single point, and the inertia from one channel at its end carries on to a certain extent through the next channel up to the elbow or knee. So here is the illustration, change from yin to yang at the fingertips. So nasa dulo po ng mga daliri, nag-change po yung from yin to yang or yang to yin. Like liver 11 to Li1. For example, the lung channel ends at the tip of the thumb where the polarity changes to yang and the energy flows into the large intestine channel. So from the lung going to the large intestine. However, this change from yin to yang polarity cannot take place instantly in one point at the fingertips. But the inertia from the lung channel is to a certain extent carried through the initial section of the large intestine channel. This can be compared to the meeting of two rivers. When two wide rivers meet, they do not just merge at the point of junction, but often the current from one river carries on flowing independently within the second river for some time. The progression of the 5 element points along the channel is probably in relation to this change of polarity. As the second point belongs to fire in yin channel and water in yang channels, this might be because the second point represents the point at which the inertia of the incoming channel is felt most and manifested itself. So here the yin channel, we have the water, metal, earth, fire, and the wood. Sa yang channel, the earth, fire, wood, and water, metal. This is the springing points of yin and yang channels. For example, the lung channel inertia movement continues into the large intestine channel. So from the lung going to the large intestine, particularly at the second point along the channel, which therefore belongs to water, reflecting the yin character of the lung channel. Similarly, the second point of yin channel belongs to fire, reflecting the inertia of the incoming yang channels. Fire. Thus, the second point along the channel represents the point of maximum inertia from the previous channel, after which the inertia becomes less and less, disappearing totally at the fifth point along the channel. This explains the particularly unstable state of the energy in the end beginning section of a channel at the fingertips and toes. This instability is another reason accounting for the dynamism of the points along it and is made use of in practice. Thank you for your attention.
Let us now discuss the source or Yuan points for the first part of the spiritual axis, chapter 1. The nature and use of the source points is dealt with in the first chapter of the book, The Spiritual Axis, and chapter 66 of another book, The Classic of Difficulties. To understand the use of the source points, it is worth looking at these two chapters closely. The source Yuan points are the following: lung 9, Li4, stomach 42, spleen 3, heart 7, Si4, bladder 64, kidney 3, pericardium 7, triple burner 4, gallbladder 40, and liver 3. Chapter 1 of the spiritual axis. This chapter makes two statements in connection with the source points, one regarding their use in diagnosis, the other in treatment. The first statement says, select the source points when the 5 yin organs are diseased. This clearly indicates that the source points directly affect the yin organs. The other statement says, if the 5 yin organs are diseased, abnormal reactions will appear at the 12 source points. If we know the correspondence of source points to the relevant yin organ, we can diagnose when a yin organ is diseased. This statement clearly indicates that the source points are closely related with the original qi or yuan qi, and that changes on the skin over the source points indicate abnormalities in the yin organ's function and can therefore be used for diagnosis. Abnormalities that can be observed on the source points are swellings, redness, congested blood vessels, commonly on kidney 3, varicose veins, a deep sunken dip around the point, commonly seen on kidney 3, whiteness, a bluish color, or very flaccid skin. When the spiritual axis proceeds to list the source points, it gives different points from the ones we usually consider. The spiritual axis lists the source points as lung 9, Taiyuan for the lungs, 2 points, pericardium 7, for the heart, 2 points, spleen 3 for the spleen, 2 points, liver 3 for the liver, 2 points, kidney 3 for the kidneys, 2 points, total of 10 points. Plus, we have the additional REN 15 source point for fat tissue, 1 point. REN 6 Qi high source point for membranes, 1 point. So we have a grand total of 12 points. Regarding these last 2 points, the spiritual axis says the original Qi of fat tissues, or the cow, gathers at REN 15. The original Qi of membranes, the Huang, gathers at REN 6. Although the book uses a different name for REN 6, this is the old name for Qi high, that is REN 6. So we have here the Yuan points of the cow and Huang, according to the spiritual axis, REN 15 and REN 6. REN 15 and REN 6 are also considered source points for chest and abdomen, respectively, as well as the source points for all the yin and all the yang organs, respectively. Cow may also indicate the area below the heart controlled by REN 15, and Huang, the area above the diaphragm controlled by REN 6. REN 15 is used for mental emotional problems arising from disharmonies of yin organs, like heart yin deficiency, such as anxiety, mental restlessness, or insomnia, and is an extremely useful point to calm the mind. REN 6 is used in deficiency conditions of the yang organs as it strongly tonifies yang qi. The surprising element in this chapter is that the spiritual axis mentions source points only for the yin organs. This is because the qi of the source points stems from the original qi, which is related to the yin organs and the kidneys in particular. The source points are therefore used mostly to tonify the yin organs. However, it should be said that chapter 2 of the spiritual axis itself, thus mention the source points of the yang channels as we know them today. Thank you very much for your attention.
Now we continue with the connecting the loop points pathways. There are 16 connecting channels, one for each of the 12 main channels, one each for the directing and the governing vessels, the Ren and Dumai, one great connecting channel for the spleen, and one great connecting channel for the stomach. However, there are only 15 connecting points, as no mention is made of the connecting point for the great connecting channel of the stomach. So the connecting points are lung 7, LI 6, stomach 40, spleen 4, heart 5, small intestine 7, bladder 58, kidney 4, pericardium 6, triple burner 5, GB 37, liver 5, do 1, Ren 15, spleen 21. The pathways of the connecting channels in blood lines are as follows. Lung connecting channel from lung 7 to the tenor eminence. The large intestine connecting channel from LI6 to the teeth and ears. Stomach connecting channel from stomach 40 to the neck. And spleen connecting channels from spleen 4 to the stomach and intestine. Heart connecting channel from heart 5 to the tongue and eyes. Small intestine connecting channel from small intestine 7 to the shoulder. Bladder connecting channel from bladder 58 to the kidney channel of the leg. Kidney connecting channel from kidney 4 to the pericardium. Pericardium connecting channel from PC 7 to the heart. And triple burner connecting channel TB5 to the pericardium in the chest. The gallbladder connecting channel from GB37 to dorsum of foot. Liver connecting channel from liver 5 to the external genitalia. Governing vessel connecting channel from DO1 to the spine and occiput. Direct vessel from Ren 15 to the abdomen. Great connecting channel from the spleen 21 to the chest and ribs. Each of the 12 connecting channels related to the main channel departs from its relevant connecting point and branches out, traveling upward along a separate trajectory. The connecting channels are called lumai. The meaning of blue implies network. The main channels are called jingmai. The meaning of jing implies line. Root or way. In chapter 17 of the spiritual axis confirms the connecting channels are horizontal or crosswise. The main channels are in the interior. Their branches are horizontal or crosswise, forming the connecting channels. The connecting channels are more superficial than the main channels, and they run in all directions, horizontally rather than vertically, like a net. In particular, they fill the space between the skin and muscles. So, thank you for your attention.
Let's talk about the back transporting points or the back shoe points. Introduction. The importance of the back shoe points in treatment cannot be overemphasized. They are particularly important for the treatment of chronic diseases, and one may go so far as to say that a chronic disease cannot be treated without using these points at some time during the course of treatment. So we have here the back shoe points: bladder 13, bladder 15, bladder 18, bladder 19, bladder 20, bladder 21, and bladder 23, which are very commonly used in most patients. The Chinese character shu denoting these points means to transport, indicating that they transport qi to the inner organs. Each point takes its name from the corresponding organ. For example, Xin means heart, and Xin Shu is the back transporting for the heart. There is a back transporting point for each of the yin and yang organs. They are located on the back on the bladder channel, 1.5 tsun from the midline, level with an intervertebral space. The back shoe points are, for the lungs, we have bladder 13, pericardium, bladder 14, heart, bladder 15, liver, bladder 18, gallbladder, bladder 19, spleen, bladder 20, stomach, bladder 21, triple burner, bladder 22, kidneys, bladder 23, large intestine, bladder 25, small intestine, bladder 27, and the bladder 28. In addition to these points, there are a few others situated on the bladder channel very close to the back transporting points, but are not related to the organs. They are related to parts of the body or channels. These are, for the governing vessel, we have bladder 16, diaphragm, bladder 17, sea of qi, bladder 24, lower back and uterus, bladder 26, sacrum, bladder 29, anus, bladder 30. The back shoe points affect the organs directly and are therefore used in interior diseases of yin or yang organs. This is a very important aspect of the clinical effect of these points. They act in quite a different way than all the other points. When treating the internal organs, other points work by stimulating the qi of the channel, which then flows along the channel like a wave, eventually reaching the internal organs. When we needle the back shoe points, qi goes directly to the relevant organ, not through the intermediary of its channel. For this reason, retain the needle in these points a shorter time than for other body points, not longer than 10 minutes when used to tonify in an adult. The back shoe points act in a quite different way than all the other points. When treating the internal organs, other body points work by stimulating the qi of the channel, which then flows along the channel like a wave, eventually reaching the internal organs. So when we needle the back shoe points, qi goes directly to the relevant organ, not through the intermediary of its channel. So this is worth remembering. Thank you very much for your attention.
Now we continue with the front collecting mu alarm points. Introduction. The front collecting points are all, with one exception, located on the chest or abdomen. The Chinese character, which is mu, literally means to raise, collect, enlist, recruit. In this context, it has the meaning of collecting, that is, the points where the energy of the relevant organs collect or gathers. These points are used both in diagnosis and treatment. They are used in diagnosis because they become tender either on pressure or spontaneously when the relevant organ becomes diseased. From the diagnostic point of view, they are more important than the back transporting points. In treatment, they are used either to tonify the internal organs or to expel pathogenic factors, often clearing heat. The front collecting points are yin in character and are more often used in acute diseases. However, they can also be used in chronic ones. In fact, this is another possible interpretation of this statement from chapter 67 of the Classic of Difficulties, according to which the front collecting points on a yin surface are used for diseases of yang, and vice versa for the back transporting points. Disease of yang can be interpreted as acute diseases for which the front collecting points are used, and diseases of yin can be interpreted as chronic diseases for which the back transporting points are used. However, as above, this rule should not be adhered to rigidly, as the front collecting points can indeed be used for chronic diseases and conversely, the back transporting points for acute diseases. The combination of the front collecting points with the back transporting points enhances the therapeutic results and provides particularly strong treatment. If a patient is seen at rather frequent intervals, 2 weeks or more, the combination of front collecting and back transporting points is effective in providing more lasting therapeutic results. If a patient is seen at a frequent intervals, twice a week or more, it is better to alternate the use of the front collecting points with that of the back transporting points in each treatment session. So, pwede papalit-palit. The front collecting points are in order of anatomical location from top to bottom. Lung, 1. So, sa pericardium, Ren 17. Sa heart, Ren 14. Sa liver, liver 14. Gallbladder, we have gallbladder 24. Sa spleen, liver 13. Stomach, Ren 12. Triple burner, Ren 5. Kidney, GB 25. Large intestine, stomach 25. Small intestine, Ren 4. And bladder, we have Ren 3. The main therapeutic uses of these points are as follows. Lung 1, it is used in acute excess patterns of the lungs to clear lung heat. Ren 17 used to tonify and or move qi in the chest. Ren 14 used in heart patterns with anxiety to calm the mind. Liver 14 used to move liver qi when it stagnates in the hypochondrium. It harmonizes liver and stomach. GB24 used to clear gallbladder damp heat in acute excess pattern of liver and gallbladder. Liver 13 used to move liver qi when it stagnates in the epigastrium or lower abdomen causing spleen deficiency. It harmonizes liver and spleen. Ren 12, widely used to tonify stomach qi or stomach yin and spleen qi to resolve phlegm and dampness. Ren 5, used in excess pattern of the lower burner, such as damp heat accumulating in the lower burner. GB25 used in acute excess pattern of the bladder to clear heat and dampness. Stomach 25 used to regulate the intestine and stop diarrhea and pain. Ren 4 used to regulate the small intestine. However, this point is not much used. not much used in this capacity, at it has many other important functions such as tonifying the kidney and original qi. REN3 used in acute excess pattern of the bladder such as damp heat. It should be noted that only 3 front collecting points are located on the channel relevant to the corresponding organ. That is liver 14 for the liver, GB 24 for the gallbladder, lung 1 for the lungs. All the others are located on channels not corresponding to their organs. For example, the front collecting point of the small intestine is REN 4, while that of the spleen is liver 13. It follows that, with the exception of the 3 above mentioned points, the front collecting points treat disorder of the internal organs, but not those of the respective channels. For example, REN4 will treat disorder of the small intestine, but not problems of the small intestine channel. The front collecting points, all situated on the chest or abdomen, it is often used in diagnosis, tenderness and pressure, or sometimes spontaneous tenderness. Used especially, but not only, in acute diseases, often used to clear heat, often combined with back transporting points to achieve stronger treatment effect. Thank you for your attention.
Accumulation or Shi points. Introduction. The Shi points are all located between the fingers or toes and elbows or knees, with the exception of stomach 34, which is above the knee. The term Shi means crevices, and this refers to the fact that the accumulation points are located in crevices where qi of the channels gathers and concentrates to plunge deeper from the superficial layers of the channel. They are points where the qi of the channel gathers and are used mostly in acute patterns, especially when there is pain. They are therefore primarily indicated for channel problems and are usually reduced as they are mostly used for excess patterns. Another characteristic is that they can be used to stop bleeding in acute cases, and especially for the yin channels. The accumulation points are, for the lungs, we have lung 6, large intestine, LI7, stomach 34 for the stomach, spleen 8, spleen, heart 6 for the heart, small intestine 6 for small intestine, bladder 63 for the bladder, kidney 5 for the kidneys, pericardium 4, pericardium. For the triple burner, we have triple burner 7, gallbladder, gallbladder 36, and liver 6 for the liver. For example, lung 6 is frequently used for an acute attack of asthma. Stomach 34 can be used for acute epigastric pain. Spleen 8 for acute dysmenorrhea. Bladder 63 and liver 6 for acute cystitis. Clinical application of the Shi points are as follows. Lung 6 is an important point for acute asthma and coughing of blood. LI7 for acute or painful syndromes of the LI channel. Stomach 34 for acute and or painful syndromes of the breast, knee pain, and acute epigastric pain. Spleen 8 for acute painful period or excessive menstrual bleeding. Heart 6 for severe heart pain, which is acute, and bleeding. SI6 for severe pain of the shoulder and scapula, and also for eye diseases with pain. Bladder 63 for painful hernia-like disorders and acute cystitis. Kidney 5 for blood in the urine or hematuria and painful periods. Pericardium 4 for severe chest pain, nosebleed, vomiting of blood or hematemesis, coughing of blood, And we have triple burner 7, pain in the arm, useful in post-viral fatigue syndrome. Gallbladder 36 for pain along the gallbladder channel. Liver 6 for painful periods, excessive menstrual bleeding, and painful urination. There are 4 accumulation points for 4 of the extraordinary vessels. That is the yang and yin stepping vessels and the yang and yin linking vessels. And these are bladder 59 for the yang stepping vessel, kidney 8 for the yin stepping vessel, gallbladder 35 for the yang linking vessel, kidney 9 for the yin linking vessel. The chi of the extraordinary vessels accumulates at these points, which makes them particularly powerful points to activate the chi of these vessels. They can be used in combination with the opening points of the extraordinary vessels. For example, bladder 59 is used for sciatica on the lateral side of the leg, combined with bladder 62 when there is pronounced stiffness and inability to walk properly. So that's bladder 59 plus bladder 62. So to summarize, accumulation or chi points are all located between the elbows and fingers and between the knees and toes. They are used for acute conditions. They are used to stop pain, and they are used to stop bleeding, especially the yin channels. Thank you very much for your attention.
Now we go to the gathering, the meeting points introduction. The gathering points are points that have a special influence on certain tissues, organs, energy, or blood. The Chinese character denoting these points means to gather or to meet and to collect various types of energies or tissues gather or concentrate at these points. The gathering points are liver 13 for the yin organs, Ren 12 for the yang organs, Ren 17 for qi, bladder 17 for blood, GB 34 for sinews, lung 9 for blood vessels, bladder 11 for bones, GB 39 for marrow. Each of these points has a special influence on the above tissues, organs, energy, or blood. Liver 13 is used to affect all the yin organs, but in particular the spleen, and is used for spleen deficiency, especially if accompanied by stagnation of liver qi. Ren 12 is very frequently used to tonify stomach and spleen, thus influencing all the young organs, especially in digestive diseases. Ren 17 is used to tonify the lungs and heart, and the gathering qi. It is often combined with other points to tonify qi. Ren 17 is also a point of the C of qi, which is an added reason for its strong connection with qi and particularly the gathering qi. It can also be used to move qi in the chest, especially in emotional problems, particularly worry and anxiety. Bladder 17 is used to either tonify blood if used only with moxa, or to move blood if used with needle. It is also useful to move blood locally to relieve upper backache. GB 34 is used for weakness or stiffness of joints and painful obstruction syndrome, the B syndrome. It is main point to influence all sinews, for example, in contracture, stiffness, or weakness of the sinews. Lung 9 is used to tonify lung qi, particularly when all the pulses are deep and thin. It also stimulates the circulation as it influences the arteries and veins. Bladder 11 can be used for chronic arthritis to affect the bones and for all bone diseases. It is an important point for bone painful obstruction syndrome, the B syndrome. GB39 is used to nourish marrow and yin in case of wind stroke. It is also used with moxa to prevent wind stroke. The above-mentioned function of these points are only those related to their particular characteristic as gathering points. Each of them has several other actions which may be unrelated to these particular characteristics. Other actions of these points are discussed in relevant chapters on the action of the points. So the gathering chi, gathering points, points that influence certain organs, types of chi and tissues. The chi of organ and tissues gathers at these points. Thank you for your attention.
Let's now talk about chronic fatigue syndrome, pathology, and treatment principles. The four main symptoms of chronic fatigue syndrome are pronounced muscle fatigue and ache, poor memory and concentration, exhaustion, persisting, intermittent, general flu-like feeling. We need to differentiate true CFS characterized by a persistent viral infection from a simple condition of tiredness following wind invasion. In other words, feeling tired after wind invasion does not by itself constitute chronic fatigue syndrome. CFS is a more serious condition characterized by the above aforementioned essential symptoms and from the Western medical perspective by a low-grade persistent viral infection. The main way to distinguish these two conditions is in the two symptoms of muscle ache and a general flu-like feeling. In true CFS, these are very pronounced and persistent. Also, in true CFS, the pulse is a certain full quality, slippery or wiry. We need to distinguish true from not true CFS using this table. So for true CFS, there is chronic fatigue for a long time. There are drastic changes in brain activity, pronounced muscle ache, and recurrent flu-like feeling, sore throat, and swollen glands. For a not true CFS, there is tiredness after an infection. There are not many changes in brain activity, and you have absent muscle ache or a mild muscle ache, and there is no flu-like feeling. Essential for application of a correct treatment principle is distinction between full and empty conditions of CFS. All conditions of CFS are characterized by combined full and empty condition. Full condition is characterized by dampness with or without heat or in fire, while the empty condition is characterized by deficiency of qi, yang, blood, or yin. In full conditions with dampness, there is always an underlying deficiency of qi, and in empty conditions, there is always some dampness. Again, it is still necessary to distinguish whether the fullness or emptiness predominates. To make this distinction, we have to attach great importance to the tongue and pulse. If the tongue has a thick coating and the pulse is full and slippery, the condition is predominantly full. Patients can still have a predominantly full condition even many years after the onset of CFS. If the tongue has a thin coating or no coating and the pulse is weak in general, then emptiness predominates. Now, you have to distinguish full from empty according to muscle ache. If the muscle ache is very pronounced, then fullness predominates. Although every case of CFS manifests with a combined full and empty condition, this is never 50-50. one always dominates. This means that our treatment choice is either to tonify the body's qi, which may be qi, yang, blood, or yin, or to expel pathogenic factors. In most cases, this means we need to resolve dampness, clear the heat, or subdue the yin fire. We have here a table outlining the features of full and empty conditions of CFS. Okay, for muscle ache, it is intense in full condition of CFS, while absent or mild in empty CFS. Tongue coating is thick in the full type, and the tongue coating is thin or no coating at all in empty. The pulse is full in full. The pulse is weak in empty. Treatment principle: resolve dampness in full, tonify the qi in empty. If the condition manifests with the essential feature of fullness, and these are thick tongue coating, slippery pulse, intense muscle ache, we have to focus on resolving the dampness. Treatment principles should be adapted according to whether one uses herbal medicine or acupuncture. When using herbal medicine, more often than not, you have to resolve the dampness first rather than tonify. Only choose to tonify the qi if there are very clear signs of deficiency. We do this because many times CFS patients, they often deteriorate when their qi is tonified at the beginning of the treatment. Even though a patient's most acute presenting symptom is tiredness, resist the temptation to tonify the body's qi. Acupuncture works in a different way from herbal medicine, as it is based purely on regulating qi. Acupuncture can be used to tonify the qi even when the condition is full without ill effects. Very often, use herbal medicine to resolve dampness and acupuncture to tonify the body's qi. Thank you very much for your attention.